All right, we welcome you back with an inspiring story this morning. After surviving cardiovascular disease, or CVD, one woman is working towards a future without heart complications. Corvonne White works closely with the American Heart Association, and this morning she's here to share her story with us. Good morning to you, Corvonne. How are you feeling today?
I'm feeling fantastic, Travis. Thank you for having me.
And thanks for putting on your red. We appreciate that. All right. Well, could you briefly tell us how your journey began?
I had a shoulder pain. It lasted for about 2 weeks. I contacted my doctor finally because I was trying to get a muscle relaxer. And she said, go to the urgent care. So I went and they did an EKG and realized she's having a heart attack right now. So I'm like, what? I proceeded on to the hospital where they did additional testing, and true enough, they had to do an emergency double bypass. And in that same time frame, 6 months later, listening to my body, they had to do a second open heart surgery.
Wow.
And I would tell every woman, anyone, that listen to your body.
Yeah.
Women's symptoms are so totally different than it is for a man. It really is.
Yeah,
and I just really wanted to share this story just so if I save one life, as my doctor told me, I'm a walking miracle.
Absolutely.
So I want to share it so that I can be an inspiration and an enlightenment for others.
Sure. And how do you help others navigate CVD?
You know, really just informing them, letting them know some of the signs. You know, for a woman, it's a shoulder. It could be your jaw. My chest never hurt, never did. So I had no idea that that was an indication of a heart attack. As I stated, I was trying to get a muscle relaxer. I had a massage. I did everything except for go to the doctor when I should have gone.
Wow, wow. Well, you know, do you have any advice? You shared a little bit there, but for women trying to monitor their own heart health and risk levels?
Several things. I would say, of course, number one, listen to your body. And number two, be conscientious, ladies. We get so busy.
Yeah.
You know, I got to do this. I got to do this. I don't have time to do that. And we have to just really take time for ourselves. Be conscientious about our diet. What we're putting in really does affect what's going on the inside, especially our heart. Yeah. And also another thing, too, that's important is ask your family. Know your family medical history. Know if there is heart disease in your family and what you can do to remain and to stay healthy.
Yeah. Well, before we go, Corvonne, what's one thing you'd like folks to know about CVD and heart health in general?
It's a #1 killer. It's a #1 killer. That every 40 seconds, someone in our country is having a heart attack or a stroke. So for women, this is very serious. You know, we don't want to live on eggshells, but we do have to live to be aware.
Well, Corvonne, thank you so much for your bravery and for sharing your story and that really helpful advice. We appreciate you. And yes, you are a walking miracle. Thank you so much.
Thank you, Travis.
All right. Have a good